of the 18th International Telemedicine Conference held by the Telemedicine Society of India with the Telemedicine Society Kerala chapter on the 10th of November 2022, hosted the Amrita Institute of Medical Sciences, Kochi. Medicine is the use of electronic information to communicate technologies to provide and support healthcare when distance separates the participants. Tele is a Greek word which means distance. Tele is a Greek word which means distance, and medri is a Latin word meaning to heal, which means distance which is being considered a burden is being overcome with today's high-end technology. Initially considered futuristic and experimental, telemedicine today is a reality and has come to stay. Utility of telemedicine is not just in accessing remote areas or monitoring home care and ambulatory monitoring, but also helps in improving communication between health providers separated by distance, critical care monitoring where it's not possible to transfer the patient, continuous medical education and clinical research as a tool for public awareness and disaster management, telementored procedures such as surgery using hand robots, to name a few. Today, we are here to celebrate this one small step for IT, one giant leap for healthcare. With this note, I would like to welcome the dignitaries to the dais. Dr. Prem Nair, Chairman of TELEMEDICON 2022, President, TSI Kerala Chapter and Medical Director of Amrita Hospitals. Joy, Secretary, TSI Kerala Chapter, Organizing Secretary, TELEMEDICON 2022, Managing Director, UNAV Telemedicine. Next, I would welcome R. Somnath, ISRO Chairman, who is unable to reach us in person owing to his busy schedule, but has sent us a video message. Next, I would like to welcome Dr. Mohan Kundamal, who is a Vice Chancellor, Kerala University of Health Sciences. Sir. Next, I would like to welcome Dr. Pradhan, who is the President of Telemedicine Society of India, onto the stage. Next, I would like to welcome Dr. Ratan Kelkar, IAS, onto the stage. Next, I would like to welcome Dr. Murthy Ramila, Secretary, Telemedicine Society of India, onto the stage. Please be seated comfortably. Thank you all. I would like to call upon Mr. Bijoy, Secretary, TSI Kerala Chapter, Organizing Secretary, TELEMEDICON 2022, Managing Director of UNAV Telemedicine, to welcome.
Morning. So I think after the call, still not that energized. Good morning, dear all. We are all here for our Telemedicon conference. This is a prestigious conference of Telemedicine Society of India, and this is the first time in Kerala we are hosting the conference. And I know that you are aware of telemedicine happening in telemedicine, and most of you are aware. Actually, Telemedicine Society of India started in the year of 2005, and it is headquartered in Lucknow. So for the promotion of telemedicine started, and in this Amrita Institute of Medical Science, telemedicine is our role. And now after inaugurated our TSI Kerala chapter in Amrita Hospital. This is actually and I'm beginning to Dr. Mohan Kunamil, the Vice Chancellor of Kerala University of Sciences. Welcome. I was the one 2 years ago. Dr. Ratan Kelkar is a started as a job situation. I welcome Dr. Prem, so the president of the chapter and the chairman of the TELEMEDICON 2022. I welcome Murthy. Murthy, I always used to call the secretary of TSI National. Sir, and I remain.
Thank you, sir.
I'm really sorry that I took all the effort to come from Jammu Kashmir, my friend is here, and from US we have a few delegates who are coming from US.
Thank you, sir. Now, let us hear from Dr. Prem Nair, Chairman, TeleMedicon 2022, President of the TSI Kerala chapter, and Medical Director of Amrita Hospitals. He is a skilled clinician par excellence and also serves as a professor at Department of Gastroenterology at School of Medicine, Kochi. He has pursued a DM and has completed his fellowship of American College of Physicians in Hepatology from School of Medicine at University of Southern California in June 1986. Dr. Prem Nair was instrumental in introducing telemedicine in Amrita in the year 2002. I request you to, sir, kindly deliver the chairman's address.
Om Amriteshwari Namaha. A very good morning to each and every one of you. It is really a pleasure to see so many distinguished people in the field of telemedicine who have come here in person. It's a great honor. Online meetings are the order of the day. So it's really, I thank you all for coming. Special acknowledgement. Mohan, special mention needs to be made of those foreign dignitaries who are long ways to be with us on this national TSI. Quite a tryst with telemedicine, largely because we have been one of the early adopters of telemedicine in the state of Kerala. primarily it started as a bridge, physical distance, as a means to bridge the physical distance between care providers and patients. Now, getting poised to leverage the state-of-the-art technology to expand its telemedicine services as technology-enabled care delivery is a unique proposition. Its expertise, largely clinical care, technology, research, and resources, as well as social. Started our activity in telemedicine fairly early in 2002, collaboration with the Indian Space Research Organization, establishing the first medicine center in the state of Kerala with the aim of providing quality healthcare services at an affordable cost. Currently in the 17th year of AIMS provides telemedicine services today to 60 national and 9 international centers. AIMS uses highly capable in-house developed applications named Integrated Solution, ITMS. Now, a wide variety of telemedicine applications, just to name a few. One of the earliest applications, apart from teleconsultations, has been remote regions of India, both in the north as well as in Lakshadweep and Andamans. All of these areas were served very efficiently by physicians in the remote locations and tertiary care physicians in our tertiary. This allowed us to limit the movement of patients from remote areas to the tertiary center, thereby substantially reducing the cost of healthcare. Disaster zones, which all of you are already very knowledgeable about, so I won't get into details, but one of the major advantages of telemedicine has been in handling disaster areas in record time. This was one of the technologies by which we were able to get improved outcomes because services were provided at the point of disaster. Other areas of activity has been in teleeducation. Teleeducation, our telemedicine, telehealth activity. And this is largely because of our 7 campuses. Because of our 7 campuses, as well as working with the government on several international teleeducation programs in some of the Southeast Asian countries. Very, very active. We have been working at it for almost 12 years. Substantial teaching and training, both for undergraduates as well as postgraduates. Other major areas has been, as was mentioned, in teleophthalmology, areas that we have been active in, dermatology, teleradiology, all of which were very amenable to activity. Research has been largely using telemedicine in public health. Public health is an activity and we're able to reach out to the community on following the pattern of the Framingham study and continue to monitor issues in neurology, neurologic deficiency, movement disorders, followed in a time-bound fashion indefinitely. One of our major successes. So today, a fertile ground for the development of expert systems. Today we talk about smartphones and 5G connectivity, and I'm sure the audience will talk about it. But 5G connectivity is going to of telemedicine throughout the country and throughout the world. And which will enable faster speeds of 20 gigabytes per second, connect around 1 million devices per square kilometer. Applications of newer technology like AI, machine learning, cloud computing, cyber security, and so on. All of these high-level functions can much more easily adapt to 5G, smartphone connectivity, or laptop. This is the cost of telemedicine by not having expenditure on infrastructure and huge on satellite links. So all of these can be much more readily handled, much more user-friendly, and with a lot of apps that come with these, the utilization of smartphones is going to change the face of telemedicine. So I'm sure that from our expert faculty forward to their contribution and your active participation. Thank you all very much.
Thank you, sir. This opportunity I would like to take to welcome Dr. Santosh Bharadwaj, member NMC, who is an ophthalmologist by profession, to the event. Welcome, sir. Now listen to the video message by ISRO Chairman Mr. S. Somnath, who was unable to make it in person to the event owing to his busy schedule.
Morning, all of you. My greetings to all of you on the occasion of the TELEMEDICON 2022 conference being organized by the Telemedicine Society of India in association with ISRO. I'm really sorry that I'm unable to join physically for this conference, which I was longing to be. Suddenly that I need to be at New Delhi today to attend an important meeting at the instructions of the Honorable Prime Minister chairing this meeting. I tell you I am very, very sorry, but still I connect with you in my heart for all the work that you are doing by the Telemedicine Society of India to propagate and utilize the telemedicine capability that has been established by Indian satellite systems of ISRO. ISRO started the telemedicine program way back in 2001 as a pilot project for connecting 5 hospitals as a proof of concept. And we know, all of you know that at that time, the satellite communication capability that we have established by our INSAT satellite systems and GSAT satellite systems were the backbone of this capability. And it was one of the most important capability to have bidirectional connectivity between the hospitals and the patients, enabling the access of medical access to those people at remote places. And this was after the demonstration of this end-to-end capability using this ICT technology, later scaled up to various other forms of disseminating the information available through the medical diagnostic instruments, using the VSAT terminals that has been established using this communication satellite at geosynchronous orbits. And I must also say this capability is not came out of ISRO alone. It came out of all those partnered with us, including the hospitals, the ministries, especially the Ministry of Health and Family Welfare, Ministry of Defense, Ministry of Home Affairs, Ministry of Labor and Employment, Indian Coast Guards, state governments, NGOs, hospitals, both in government and private sector. So I must take this opportunity to thank all of these ministries, departments and organizations and institutions for popularizing it as well as making best use of this capability that is provided by this space technology. The most important part of the telemedicine capability is to connect with the rural and inaccessible areas, especially the rural areas and hospitals. And this has been done through permanent installations as well as mobile installations moving across various places. And this satellite communication has been the backbone of all these activities. By 2010, through the steady activities of all these stakeholders, almost 380 hospitals were connected across the country through this telemedicine network. Among these were 62 specialty hospitals providing consultations to 300 remote hospitals and 80 mobile ones. At present, there are about 210 telemedicine nodes which are operational, and many of these are for defense and paramilitary forces, which they need most, especially when they are located at the remote and inaccessible high altitude regions such as Jammu and Kashmir, Leh, Ladakh, including the Siachen Glacier. During the COVID pandemic time, really we saw the benefit of telemedicine capability. More to the similar concept that was available through net connectivity. What the telemedicine program did at that time was continuing medical education for emergency preparation for handling COVID-19 pandemic. And many hospitals connected and they conducted these programs, especially including the Air Force hospitals and also the studios of DECU of ASRO participated in enabling this continuing medical education program throughout the country. From the public institutions and private institutions, today we are seeing many of the commercial agencies taking up this capability and propagating it through various solutions which are provided through mobile devices and apps. Then we know that today the capability in this sector is also increasing, especially the high throughput bandwidth connectivity that are available than the low bandwidth solutions available through the VSAT connectivity. And we would like to see how this capability can be further expanded through seamless connection between users and the hospitals which are able to provide such capabilities. We have recently moved our communication satellites from ISRO's fold to NSIL, and they are going to be the holders of or operators of those 10 communication satellites. And in the future, the high throughput satellites which are in our disposal, 3 of them are already there, ISRO is operating, that also will move to NSIL's fold. All of you are maybe aware that the high throughput satellites have been already contracted to provide internet services to the remote part of the country at much higher bandwidth than that they were capable through the earlier VSAT connectivity. And I look forward to using these satellites specifically, creating some platforms for connection between VSAT terminals at one place and internet connected users and applications at other points. So this will really change the way we have been using the telemedicine connectivity, especially from cities where we have high bandwidth internet connectivity and terminals at remote places where the satellites can directly beam these to the signals to the VSAT telemedicine nodes, especially at remote and inaccessible areas. Would also like to see how telemedicine capability can be further expanded to larger segment of the society. I think there are penetration requirement for today is much more than what used to be earlier, and especially when the public are more aware and happy with the type of teleconsultation for feasibilities and the benefit that are come out of such teleconsultations, where the people with the diseases having mobility issues, etc., need not have to travel, and ability to diagnose the patients by the doctors through this type of connectivity also has improved. The confidence also has improved, and I would like to see larger penetration of this capability in the coming days with the startups and the commercial actors coming to this sector much more in the days to come. And we also request hospitals and the administration of this hospital to take up this as very important capability, and especially with the type of regulations and changes that are come, I believe it will be to the advantage of all players in this sector, including hospitals, doctors, NGOs that ensure delivery of the services, as well as satellite operators and technology providers in the coming days to come. So let me greet each one of you during this medicine conference of 2022 being organized at Amrita, and wish you excellent deliberations and look forward to solutions and suggestions to Department of Space and Indian Space Research Organization to take this capability and activity forward in the forthcoming satellites. Thank you so much. All the very best to you.
Now I invite all the dignitaries to light the lamp and mark the beginning of the 18th International Telemedicine Conference, TELEMEDICON 2022, with the blessings of God Almighty. Kind I would like to call upon Dr. Mohanan Kunnumel, who is the Vice Chancellor of Kerala University of Health Sciences. Dr. Mohanan Kunnumel hails completed his MD in radiodiagnosis from Tirunelveli Medical College and supervisory training course in medical administration. He has bagged many honors, including State Government's Award for the Best Doctor in 2016. He has served as the State President of Government Medical College Teachers Association from 2011 to 2014 and as a President of National Radiological and Imaging Association. He is currently serving as the Vice Chancellor of Kerala University of Health Sciences. It's an honor to welcome him for the inaugural address. Sir, please.
A very good morning to you all. Chairman of this wonderful function, the President of Telemedicine Society of Kerala, Dr. Prem Nair, IT Secretary of Kerala, Dr. Ratan Khelkar, the Secretary of Telemedicine Society of Kerala, Mr. Vijoy, the National President of Telemedicine Society, Dr. P.K. Pradhan, and the Secretary, Dr. Murthy Ramelu, and Dr. A.K. Singh, eminent health technology experts, specialists in telemedicine, and my dear students. I'm extremely happy and proud to stand here in this wonderful hall. 2 years ago, before COVID, I had the privilege to inaugurate the Telemedicine Society of Kerala, and now the Telemedicine Society of Kerala has grown big and we are able to organize a national conference. So I congratulate all those who are behind this society. Telemedicine, as Professor Premnar was saying, and Dr. Somnath was saying, it was in India for more than 20 years. ISRO was taking lead. But that was a connectivity between hospitals, that was a connectivity between experts. But the connectivity between a registered medical practitioner and a patient was not robust. It was there, but then a case came in Mumbai High Court in 2018. One medical practitioner gave consultation to a patient and some unfortunate thing happened to the patient. Then court said, you don't have a law to conduct teleconsultation. There is no law. That means what you did was illegal. We have been doing it for a long time, but then there was no law. And now an interesting thing happened. COVID-19 pandemic came to India in January 30th, 2020. In fact, it came to Thrissur, where the Kerala University of Health Sciences is located. So, and I was there in the first meeting. That's incidental. Then the country went on to lockdown on 24th of March 2020. 24th of March, country went on to lockdown. And the telemedicine guideline policy was announced by Medical Council of India on 25th of March of 2020. It may be just coincidental, but then when you look back, India went on to lockdown, so you cannot see your patients, you cannot consult, and the government is coming with a telemedicine guideline on the very next day. Of course, it was there, it was being planned, but then it looks very nice. So we have a guideline. Now it is legal. Now you and me can consult our patients legally. So that is the current position. But then the guideline says that all those who want to do telemedicine consultation must be trained within a period of 3 years. And after 3 years, you cannot practice telemedicine without training. And the job of giving this training is the medical council says that they will create a program and with which they have to be trained. Till today, I don't think whether the medical council has created such a program. No such program is there. And 2023 March 25, you cannot practice telemedicine if you are not trained. This is the rule. So what is the solution? We have to train. And who will do that? Telemedicine Society of India. It is the job of the Telemedicine Society of India, it is the job of the Telemedicine Society of Kerala to create a module to train doctors how to practice telemedicine. And as the Vice Chancellor of Kerala University of Health Sciences, I am ready to implement the same if the guideline has been prepared. So we will do in our university, and we can do. Incidentally, last week I have been given one more university. Now I am the Vice Chancellor of Kerala University also, because of certain reasons, but now I am having 2 universities. So this can be implemented by us, by the Telemedicine Society, so that we can enable each and every one of us qualified, legal, competent to practice telemedicine. In fact, I'm a radiologist. Being a radiologist, I know how important this teleconsultation is. My residents usually send me a CT scan image or an ultrasound image and MRI image in my mobile. And then I see and say that this is this, this is that. So this is, of course, the image may not be very good because my quality of the this thing. But then this teleradiology consultation was going on. In fact, one of the most prominent teleradiology the services in India started almost 20 years ago. A radiologist, very eminent radiologist, was working in US. He wanted to relocate to India, and it is said that at that time he could not get a good job in India. And then he started giving consultation to his American clients. He was from Yale University. So it is said that an accident happens in US near a big US hospital, or the patient is brought to the US hospital and the CT scan or MRI and all these images are taken, and you may not have a radiologist at that time, and the number of radiologists may not be sufficient, but the image is sent to Bangalore. Within 30 minutes, the report goes there. The CT or MRI of a patient is taken in a hospital in US at the midnight, and by the time the patient is shifted to his room, the Indian report reaches there. It is there for the last 20 years. And there was a study conducted by well-known authorities, the quality of the report. And they say that Indian report is much superior. Because of various reasons. Number one, the reporting is done by large number of radiologists sitting together during daytime. And this happens in night. And you don't have a radiologist there, and he will be sleeping. So we were giving excellent reports, and that gave huge business for teleradiology solutions in India. In fact, sometime back, I had an opportunity to attend the Radiological Society of North America conference at Chicago, which is one of the largest radiology conference. About 60,000 people participate. So some of the radiologists said, if you continue like this, many of us will become jobless. So this, of course, it won't. There is a huge demand. Actually, what we are offering to US is a different question, but we have to offer it to our people. We have to offer this to the people who are living in remote parts of the country. In fact, Kerala government is doing it in a very well way because they have hospitals in Kasaragod or the CT scans, and we don't have sufficient number of radiologists. The number of radiology seats are few, and it will take long time to have. In fact, when I joined as a radiology postgraduate in Kerala, that time there was only one seat in the state. Just imagine. So crazy now when you look. So what is the solution? Now there are several companies who are offering solutions. In fact, the public sector company HLL is also giving reports, and their help is used by the government of Kerala. So this tele-consultation, tele-radiology is going to stay. And now regarding telemedicine, in fact, I was told that Prime Minister has launched a huge program called Telemanas for psychiatric illnesses. And that is the only solution we have. How many psychiatrists we have? Even a state like Kerala does not have sufficient psychiatrists. Then think about the entire country. And we may take another 20, 30 years to have as many psychiatrists as possible. Then till then, who will take care of these psychiatric patients? So we have ASHA workers, we have Kudumbasri workers, we have got nurses, we have got... So such people can see the patient and they can tell the signs, and then you can have a consultation at the Taluk hospital, consultation at the district hospital. And now cancer consultation is coming up in a very big way. Now, I was part of a program where we can detect cancer early, and then this will be done through ASHA workers who can identify certain features. Photograph can be taken, it can be uploaded, it can be sent, whether it is a leukoplakia or it's something else, is the lump. So all these issues can be solved now. Now you have telepathology. How many pathologists we have? So technicians can take nice slides, and that can be uploaded, and it can be, the report can be given by a pathologist sitting in a district hospital, and if that person has got a doubt, it can be uploaded to the medical college or bigger centers. So you can have a seamless consultations, and all these things are possible because of the medicine, tele-radiology, tele-pathology, tele-ophthalmology. I was told you have a picture of the fundal picture, and an expert will have a sharper opinion than a junior person. So you can have a consultations. Rather than shifting the patient, you shift the image, you shift the picture. So that is the most important thing. I have a dream that maybe with this 5G and all this technology, you can have a holographic image of a person. This person can be, so that the doctor will see the person standing in front of him. And I have a dream that maybe the cross-sectional image also can be seen. Why not? The holographic picture sitting in front of you, and he wants to see the cross-sectional image of the brain. Can we see that? Maybe one day the technology will do that. Nobody thought all these things will happen. Maybe after a few years all these things will happen. And the patient wants to see the doctor in as a live person. Doctor can go to the patient's room, patient's house in a holographic image. All these are possible. So we can have all these dreams. Everything is possible. And now, India, the number of aged population is slowly increasing. Now, as on today, 16% of our population are above 60. And in Kerala, it is much, much higher. And by 2050, 20% of our population will be above 60. And most of these people will have various diseases, non-communicable diseases, hypertension, diabetes, and it needs regular follow-up. And traveling from your home to the consultant, it will be very difficult. So we can have teleconsultation. And in fact, a lot of people are doing diabetes management. Many of my friends are doing teleconsultation only. They are very comfortable. They started during the time of COVID because they were afraid to see the patient. And now they say that COVID has gone, but I am comfortable with this. And the patient also says, COVID has gone, I am comfortable with this. So this is a reality, and this will stay with us. So these are all the great advantages of this wonderful technology. But then Telemedicine Society has got a great role in making it more popular and also training all the people who are going to use it. In fact, in the definition of telemedicine, the Medical Council says teaching medicine also is part of telemedicine. And that is what we have been doing during COVID time. Suddenly our colleges were closed and we did not know how to teach our medical students. And then we started online teaching. And then slowly we realized it's very good. And now University Grants Commission has come out with a statement. Now onwards, 40% of the teaching should be online and 60% need be physical. So the usefulness, attractiveness of online teaching has been recognized by University Grants Commission itself. So this is going to stay and this will stay. And with these few words, I declare this conference inaugurated. Loga Samasta Sukhino Bhavantu. Thank you.
Thank you, sir. Next, I welcome Dr. P.K. Pradhan, President of TSI, to deliver the presidential address. Dr. Pradhan is currently serving as a professor in nuclear medicine and nodal officer of School of Telemedicine and Bioinformatics at Sanjay Gandhi Postgraduate Institute of Medical Sciences, Lucknow. He has completed his medical school from VSS Medical College, Odisha in 1987 and MD in Biophysics from AIIMS, Delhi. Later received Diploma in Radiation Medicine from Radiation Medicine Center, BARC, Mumbai in 1994 and DNP in Nuclear Medicine from National Board of Examinations, New Delhi in the year 1995. He is received Commonwealth Fellowship in UK in Nuclear Cardiology in 2005 and Best Clinical Paper Award from Society of Nuclear Medicine in 1997. He is Fellow of Asian Nuclear Medicine Board, member of many nuclear medicine societies like Society of Nuclear Medicine and Molecular Imaging USA, European Association of Nuclear Medicine, Europe, and fellow member to Asian Nuclear Medicine Board. His major interest is in utilization of radioisotopes in the treatment of non-cancerous and cancerous disease conditions and in nuclear cardiological procedures. He has also been the president of the Society of Nuclear Medicine India, Federation of AOFND, Asia as Oceania Nuclear Medicine and Biology, President Nuclear Cardiology Society of India. He is currently President to TSI. I welcome you, sir.
Good morning to all of you. Honorable Vice Chancellor of Kerala University, our chief guest of this inaugural function, Dr. Mohan Kundumai, chief guest of this function, guest of honor, Dr. Ratan Kelkar, who is the IT Secretary of Kerala, Dr. Prem Nair, who is the organizing chairman and president of Telemedicine Society of Kerala, and Mr. Vijaya, organizing secretary of this conference, and my TSI colleague, Dr. Remila Murthy, honorary secretary of Telemedicine Society of India. Let me brief a bit about the Telemedicine Society of India. It started informally with great stalwarts who are primarily of both doctors and technologists, And I think ISRO and a lot of stalwarts from different parts of the country came together informally. And in one of the congress at Lucknow, they thought that they will make a society which will pave paths for this telemedicine in the country. I think thanks to all of your visions. And I was a passerby by that time. I was just assistant professors. And I take pride to be from the inception time. I was associated with the telemedicine, and now I am fortunate to be the president of this society. And this became registered as a society, as a non-governmental organization and as a charitable trust for development of academics, research, training components of this society, and to make popularize the telemedicine. And this became, it took 2 decades. I know how much struggle people do. Many times it does mostly in the academic organization with the different research projects or grantiness, and individual players from the companies or vendors, they used to also equally struggle. I know many of the companies who came and vanished away from this telemedicine also. But at the same time, I think it took long years in the incubation period to manifest as a real specialty. And fortunately or unfortunately, I think after 2 decades, the COVID pandemic came, and though we, as a society, we are trying to really lobby and explain and impress the ministry to make a law, but it soon happened because of the COVID-19 pandemic. I think you listen to the Vice Chancellor regarding that. And this revolution, because of the COVID-19 pandemic, which became an opportunity for telemedicine society, but those organizations who were involved, I think they contributed immensely to the COVID care. Very quickly, they just switched over for the care of the COVID pandemic. That became a boon for the care of the COVID pandemic also. TSI has currently more than 800 members approximately, and now every year, which was earlier hardly sometimes 10 members, 20 members, this has shown a incremental numbers now each year, and it has come to now 75 this year and per year. That means it has shown an increment, and people have started showing their major interest to be a member of the Telemedicine Society of India. And basically this society engages themselves annually, a international and annual event which is happening now in this Amrita Hospital, and basically to discuss the development of telemedicine and how its role in the healthcare landscape. Actually, we need really simple technological solutions for simple needs, just like your WhatsApp messaging, and which can also scale up to a larger populations. Most of the telemedicine we are doing for the last 20 years, we have observed that we could not scale it upon. Either it's a pilot project or it's something. But with the advent of 5G technology, IoT and augmented reality, I think it can be scaled up, and also to the mobile platform. It is very much necessary to scaling up for a larger population currently which is deprived of the healthcare, basically the rural populations in our country or across the globe. Secondly, it should be simple, it should be fast and straight remedial measures. That's why it is described in the literature as a very disruptive technology. Like you have to think something, all these new companies who wants to really enter to the telemedicine arena for the healthcare landscape, I think the doctors have to think for very simple the problems, and also how the simple remedial measures which can be done quickly at their home or at, that's the best solutions for really for the healthcare. And just like for example, suppose somebody has a loose motion today and he doesn't want to go to a doctor. It is just like we go for off-the-shelf medicine. Similarly, the healthcare also should be to some extent for the primary care or simple remedial measures for this illness. It should be just to prescribe a simple antibiotic along with the metronidazole or something for the loose diarrhea. That can be just a remedial measure. And quickly, if somebody can tell, that means within minutes it is finished, then and there. If it continues, that kind of fast solution is also there. And there is a data also in the literature that 30 to 50% of the patients, they sometimes don't attend even a doctor's in their lifetime. So if you can address that space, either through your wellness or these simple measures like a UTI or something like conjunctivitis, it can be really fast. And I think the message is very clear now. These disruptive technology, which is a low-end solutions, this should be really addressed, and this will be a new market, basically solutions for the care of simple remedial measures. It can be addressed with anything, whether it is a allopathic medicine or it is a Ayurvedic or Ayush, any form of medicine which is liked by the people can be taken care with this simple remedy. So this is what is the role of all these 5G and mobile. I think mobile, everything has to transfer to the mobile platform now, and which is possible now. And quickly, within 2 to 3 years, we can all realize that it has become in everybody's hand, and the simple care will come up. Thank you for your patient listening, and thank you.
Thank you, sir. Dr. Ratan Kelkar is an IAS officer of 2003 batch. After completing his MBBS from Bangalore Medical College, he went ahead with the Indian Administrative Services Officers training in Dehradun. He is serving as Special Secretary, Department of Agriculture, Government of Kerala. Under him, his guidance, Kerala was adjudged leader state in India after analysis of Food Safety and Nutrition Index. He was also crucial in implementation of Ayushman Bharat Karunya Arogya Suraksha Paddhati, a health insurance scheme for the below poverty line people of state of Kerala. He has served as a mission director, National Health Mission, Government of Karnataka from the year June 2016 to December 2018. He has also served as CEO, Center for E-Governance, Government of Karnataka, Facilities of IT for the benefit of common man. He was also the District Collector and District Magistrate, Kannur District, Kerala, Additional Director, Department of Tourism, Government of Kerala, MD of KTDC, Kerala Tourism Development Corporation, Director of Urban Affairs, Department of Local Self-Government, Kerala, Director of IT, Kerala State IT Mission, Sub-Collector and Sub-Divisional Magistrate, Devikulam, Idukki District, Kerala. Honored to welcome you, sir. Welcome you.
Dignitaries on and off the dais, and dear delegates, at the outset, let me congratulate TSI for organizing a wonderful event of this nature in Kerala and at a very opportune time, I would say. The reason being, there has been a lot of acceptability of technology in healthcare, probably after the start of pandemic. Though we are not in a state where I can say we are off the pandemic fully, but yes, there has been a lot of acceptance of technology, mainly because there was a restriction on movement of people as well as interaction between patient and doctors. So this has led to a level where people have started to embrace technology and we started to deliver health services using technology as a media. Now, technology as an entity has impacted all sectors, and more so the sector of health at all levels, preventive, curative as well as rehabilitative. And there are multiple examples of how technology has assisted the people in accessing good health care, has assisted the state governments in ensuring effective delivery of health services to the last mile. And there are also examples of how technology has improved the lives of people by efficient curative services and how people who are bedridden are also assisted to a large extent using technology. Because of the advent of technology, there have been more assistive devices and instruments and equipments which has made the lives of people very, very easy. And to that extent, I think I would like to say that we are living in very interesting times where we have to embrace technology. There is no other go. Technology is there to stay, and how best we use technology to further the interest of our own requirements is left to us. Now, we've been seeing a lot of development in technology, especially in the healthcare, and how the solutions are making lives of people easy. But if you look at the number of people who are using this technology as a media, I would still like to believe it's just a minority. The reason being, there are a lot of solutions in the market. They are out of reach of many of the people. It's very costly. And there are solutions which probably may not be affordable even to the government. So if you really want to address public health as an issue, or as you want to reach to more people than what you're doing at this point of time, I think we need to standardize these products. We need to have mechanisms of business models. We need to have good CSR brought in to assist the government to reach to more people than what it is possible now. The solutions should be more cost effective, even for the government to afford and take it forward. And for that to happen, I think the R&D mainly has to play a major role. The companies have to think health as a service and not as just a business. And a group like this, where you have industry, practitioners of medicine, the startups, the biggest and the brightest minds in the sector, the government as an entity who can probably weave together a fabric of all of these to make this solution cost effective and try and reach out to the common man in a truest sense of efficient healthcare delivery. And if that can happen, the advent of what we are discussing now in terms of augmented reality, AI, ML, big data analysis, all that is possible provided everybody here in this room do not think health as a business, but as a service. We understand health sector companies need to definitely stay afloat, and for that to happen, of course, you need to have good your business plans. And if we can all come together thinking of addressing the requirements of the public health, more so in a country where more than 70% of the people are in the rural setup, I think we all need to come together as a team and have that golden handshake and weave together a fabric which can meet the requirements of the people. And I can see that happening in Kerala when, as the VC just mentioned, when we had the COVID pandemic and people had to start accessing technology in a bigger way than what it was earlier. Earlier people would use video chats, WhatsApp and things like that, even to reach out to the doctors. They used to have one-to-one communication with the patient, but there was an issue of data privacy, issue of data security, management of data, use of technology without a proper scheme would lead to misuse of technology. And when the telemedicine guidelines came in, we in the state of Kerala have been very proactive in using this guidelines and using the platform which is provided by CDAC Mohali called eSanjeevani, which was a pan-India based activity at that time. Kerala took it up very seriously, started implementing telemedicine in a big way, trained all the doctors at different levels and the technicians at different levels, the staff at different levels, so that people, when they come to the nearest center or even from their home, when they're trying to access services, we are able to create a good mechanism of healthcare delivery using teleconsultation. And using that same mechanism, we've also been able to prescribe medicines, ensure door delivery of medicines to people, and this is the way to go forward in leaps and bounds. And we are still at the, still I would say, probably the first or second step of embracing this technology. Technology has always been, though we invent technology, we've always been laggards at embracing technology for our own requirements. And government, especially the public sector, has still been behind the private sector when you look at technology. Now, even when you're talking about remote ICU or remote or teleradiology as an entity of delivering healthcare, private sector has always been ahead, mainly because you have a clientele and you have a good business model and you can spend money. But such kind of investment is not available, no such kind of resources are not available with the government to spend. So what happens there is, when government is the machine which is meeting the majority of the requirements of public health, I think a handshake with the private entities, the private sector, is the way forward. And that is what we are looking at doing. And I was extremely glad to meet Professor Kamal, who has offered his services for taking this forward with the government of Kerala. And we have also the people from the National Health Mission sitting here who will be coordinating with him to take this initiative forward. I think this is what is required when we move forward. Technology has always been there, man has always been very creative, creating various things, but unless we use it efficiently to the bigger clientele, the last man who has no access to technology, I mean, once you start reaching that person is when the benefit of technology would really be useful to mankind, and that is the way forward. I mean, these kind of collaborations are what probably missing, which has led to technology being reserved for few groups or categories in the society and probably being out of range of the common man. But now, like I said, we are in interesting times. We have now started saturating all areas across the country using 4G. There is a scheme introduced by Government of India where each and every hamlet in most interior places have to be covered with the 4G, and the deadline is December 2023. And even in Kerala, we have identified around 500 locations which are out of reach of people in terms of connectivity, and we are looking forward for connecting these people as well on the 4G. Now, after the launch of the 5G technology in the country by the Honorable Prime Minister, the state of Kerala has also been advancing towards ensuring we are 5G compliant, not only in terms of workspaces where people work, but also at public places, even some interior places where this technology can be made use of. We are looking to work with the telecom operators and the TSPs to ensure we have some kind of a mechanism to reach to the most interior places, probably an ambulance fully fitted with all the devices, having connectivity of 5G, beaming these reports back to a command center which can advise people in the most interior areas. That is another activity which we are looking at doing. So 5G opens up a lot of opportunities for healthcare mainly. Of course, there are other sectors like agriculture, manufacturing and all that which will also be touched upon by 5G. But healthcare, which reach to people, which is basically the most important requirement of anybody, would be assisted in a large way by 5G technology. And a lot of 5G can be used by startups. And they have brilliant ideas of having a technology, or rather making use of technology, and government through its mechanism is supporting startups in a big way. Kerala is the leader in startups. We were also awarded the best state in terms of supporting startups, and we have a lot of brilliant people in the state who are capable of coming out with multiple products and using 5G as a mechanism to reach out to people and making their lives much more simpler. And government is supporting all of these ventures, not only in guiding the startups, but also ensuring they monetize their ideas and also ensuring they have products in the market which will assist the common man. I mean, this is the kind of activity which the state government is very keenly following up with all the startups, and we look forward from such kind of gathering. We look forward for ideas to take our initiatives forward, and also to act upon some of your brilliant ideas. The state would be more than happy to work with the TSI to take such ideas forward. Whatever idea is coming out of this deliberation in the next 3 days, I think we'll be looking forward for such ideas to take it forward, and we will be more than happy to support TSI in their journey forward. And I see a lot of possibilities in these 3 days, the kind of the speakers you have identified, the kind of topics you are deliberating upon is very, it's quite enthusiastic to note such kind of ideas being worked upon. And let us as a team move forward towards the common good, and health being one of the highest priorities of each and every one of us. Let us work as a team to ensure that the healthcare is delivered to the most interior people, or most interior areas, to the poorest of the poor people. Generally what happens is, when we're looking at giving service to the poor, it is generally seen upon as poor service, because you always do not take the best. It is always seen that you're taking the second best to the common people. That is how it is generally seen. But we want to change that mindset. We want people to understand that the best of services, what they get in the best of hospitals anywhere in the world, is what they get at their doorsteps. I mean, that kind of thinking should come in their mindset, and that will only come if all of us work as a team and make sure that they get the best of services. So I hope that this 3-day deliberation will be very fruitful. Brilliant ideas will flow out of it, and we'll work upon those ideas to ensure we give the common man the best of services, and ensure that continuum of care, so that they get the best of services even at the comfort of their homes. So I wish you a very happy deliberation, and extremely thankful for the organizers for getting me here to participate in your inauguration. And I hope that I'll also find time to attend some of the sessions in the next few days as well. Thank you very much.
Thank you, sir. Dr. Murthy Remiller has a diverse career graph spanning 33 years of rich cross-functional experience covering the technical, business and managerial domains, and currently working as Head of Project Management and Budget Division in Human Spaceflight Group of Gaganyaan and Checkout Area, URSC, Bangalore. He holds a Bachelor of Engineering degree in Electronics and Communication and Master's degree in Business Administration. He has received the Department of Management Studies, IISc Bangalore, International Business Research in 2010. He served as Head of Supply Chain at URSC. In the societal applications of space technology, he has been associated in the program development and coordination of telemedicine and tele-education services in India during 2011 to 2012 to expand the reach of telemedicine across India, and has been serving in his personal capacity as member of TSI since 2012. He was on the board of editors with the American Telemedicine Association's Telemedicine and eHealth Journal for 7 years, and was a co-editor of the Telemedicine Manual and member of National Task Force on Telemedicine, formed by Indian Ministry of Health and Family Welfare. He is serving as the Honorary Secretary, Telemedicine Society of India, following his service earlier as member of the Executive Committee of TSI and as a Vice President of Indian Society of Geomatics. His professional achievement includes 45 plus publications in business strategy, marketing, remote sensing, telemedicine and societal applications of space technologies in various national and international journals and conferences. His contribution includes expansion of the Indian remote sensing satellite data market across 16 countries with 22 international ground stations and 20 international reseller network, expansion of ISRO telemedicine stations to 390 nodes comprising rural and special hospitals and mobile vans. Study for establishing a supply chain management system for spacecraft realization and smooth program and project management at IRS and Gaganyaan respectively. It's an honor to welcome you, sir. I would like to welcome you to talk to us about the scope of this conference and to deliver the annual report.
Good afternoon to all the delegates. ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. I stand before you as the Honorary Secretary of the Society to present the annual report last 1 year, and also I was given an additional task of briefing about the conference and the proceedings overview. We are happy to say that there are about 120 speakers spread across 25 sessions in the 2.5 days which we are going to deliberate on the telemedicine application and different technological as well as societal domains. These sessions cover different aspects like teleophthalmology, tele-ICU, telemedicine in academics, success stories of telemedicine and telemedicine practice, symposium on digital surgery, government initiatives and successes in the telemedicine, space medicine, that is telemedicine for astronauts, and AI in telehealth, telepsychiatry, and the panel discussion on the legal aspects in the telemedicine, telepediatrics, and telehealth practices and international standards. These are only the short list, and we also have different research papers totaling about 50 papers, 47 to be precise, covering the data management, AI, web-based telemedicine, remote monitoring and prediction, smartphones in telehealth, community health care and community health aspects of the telemedicine, etc. Now I come to my main job of the Secretary's report. Dear members and audience, I am happy to report good progress in the expansion of the society and promotion of the telemedicine in the last 1 year after the last International Conference of Telemedicine at Lucknow in 2021. As the distinguished guest has told, we are not in health as a business, but definitely all of us take that our business is healthcare. All of us are aware of the onset and effects of the COVID on our lives world over, and the society has been promoting telemedicine for last 20 years, but the awareness created by the COVID about the need and use of the telemedicine is much bigger than what all we could do in the last 18 years. This is like recognizing the value of oxygen in the COVID period, though oxygen was all around us previously. Also, the telemedicine practice guidelines were issued by the Government of India, Ministry of Health and Family Welfare in 2020. Taking these two into consideration, your society has expanded the training session to doctors, paramedics, other stakeholders in the telemedicine field, covering evolution of the telemedicine practice guidelines, medical, ethical and legal issues. More than 30,000 people in the last 3 years and to a good extent in the last 1 year. More and more organizations and individuals are asking for specialized training in different medical specialties, and the discussions are going on with them. I am happy to inform the members that your society is now a truly pan-India society or an association from Kanyakumari to Kashmir. Happy that 3 new chapters are inaugurated in this year in Chandigarh, Gujarat and Jammu Kashmir, totaling to 14 state chapters. Also, 2 state chapters in Uttar Pradesh and Telangana are relaunched and reactivated in the last fortnight. Plans are also on to open state chapters in Uttarakhand and Himachal Pradesh by December 22, January 23, Bihar and Jharkhand by February 23, Northeast and East by March 23, and Goa by mid-2023. At the same time, your society needs more qualitative outcomes and activities in the states and regions, in addition to increasing the quantity by number of the state chapters. TSI headquarters will continue the efforts and request cooperation and proactive approach by the state chapters as well. We place our appreciation to all the state chapters and particularly Chandigarh, Gujarat and Jammu Kashmir who have formed the new state chapters this year. As an activity, we have also initiated dialogue with the Uttarakhand and Himachal Pradesh governments following my personal visits to these two states for a tie-up with TSI and the National Health Mission, and also training programs to the state government officials and employees in those two states. In terms of membership also, we have a progression by addition of about 80 life members, one startup member, one institutional member since the last conference, and totaling to about 870 or so, and we wish to reach 1000 by the end of this year 2022. Most importantly, the society had 10 to 12 special general body meetings for approving the amendment of the bylaws in tune with the changing trends and requirements. Also, we are moving towards a TSA manual as a standard operating procedure for day-to-day functioning in addition to the bylaws, which are like a constitution. The society places on record the appreciation to Jammu Kashmir team for the successful conduct of the midterm conference 2022 and Maharashtra chapter for Maha Telemedicine Conference in 2022. In all, we are expanding by geography, active, but still there is much more to be done and we are all committed to take this forward. Once again, thanks to all the members and also associates and delegates for your patient hearing of this report, and see you all in a midterm conference probably in the east or northeast in 2023 and the annual conference in Goa on November 2, 3, 4. Thank you once again, and I take leave from the annual report. Thank you.
Thank you, sir. Now I'd like to invite Dr. Murthy Ramila, Secretary of TSI, for felicitation of the past President, Major General A.K. Singh, retired. Thank you.
Once again, I am back to felicitate the past President. We have this tradition, and today we felicitate Major General retired Dr. A.K. Singh, Jaipur. In his absence due to the personal reasons, I read the citation and I request the President TSI to join me. We will be sending the citation and a shawl to Dr. A.K. Singh. The members of Telemedicine Society of India consider it a pride to felicitate you for your special work in the field of telemedicine application and your contribution to the growth of telemedicine in this country and specifically in the rural areas. We are glad to note, born in 1952, you obtained MBBS from AFMC Pune and PhD from Linköping University, Sweden in medical informatics. Since then, you have been emphasizing and focusing on medical informatics and continuing your passion. Presently, you are serving as an advisor in health informatics to Mahatma Gandhi University of Medical Sciences and Technology, Jaipur, and also running BSc course in Hospital and Health Information Administration. We appreciate your services post-retirement also. On the professional front, you served in the Indian Army from 1976 to 2012 and served in many parts of India, Lucknow, Assam, Mizoram, Nagaland, etc. You had been to Canada, Austria for conferences and official duties. The heartening part is you are continuing your passion for rural health through telemedicine. President TSI during the term 2019 to 20 and were heading TSI during the remarkable year when when the telemedicine practice guidelines were issued by the Ministry of Health. You have made major contribution in forming several special groups in TSI and worked hard to reach telemedicine to many people through TSI training programs. Overall, your interest in expanding the telemedicine in India is laudable. Thus, the hard work and devotion to your work have established you as a professional of high repute. Sir, Dr. Major General A.K. Singh, the members of TSI consider it a great opportunity to felicitate you on this auspicious occasion. We wish to see you every day as healthy and as active as you are today and serve the country for long. Thank you.
Thank you, sir. Now I welcome Mr. Kevin Devisya Valiamatam, Assistant Vice President, Rajagiri Telemedicine Network, for the vote of thanks.
As a member of TSI Kerala chapter, it is a great honor for me to propose the vote of thanks. First and foremost, Shri R. Somnath, ISRO chairman, for his video message. We all know how difficult it is when Prime Minister calls you and last moment you have to make a video message. So we thank him for taking this opportunity, giving us this opportunity to listen to him. Thank you, sir. I thank Dr. Mohan, Vice Chancellor, Kerala University of Health Sciences, for taking time out from his busy schedule and gracing this occasion. Thank you, sir. Dr. Ratan Kelkar, IAS, for sharing his vast experience in technology and giving a wonderful talk. Thank you, sir. Dr. P.K. Pradhan, President TSI, for gracing the occasion and for leading TSI from the front. Dr. Murthy, Secretary TSI, a vibrant personality who is opening TSI across India, and we thank you for taking this initiative. Past President, Dr. A.K. Singh, who is not with us, we thank him for leading us last year. Coming to the home front, the chairman of this conference, Dr. Prem Nair, thank you, sir, for being so kind, nice throughout the Telemedicine Society of Kerala's formation, leading us in the front. And we thank you for being a fatherly figure and helping us go through it. Dr. Ms. Sudhamani, who is the retired Joint Director of CDAC and currently the Director of eHealth Kerala, we thank her for her guidance. Dr. Divya, Telemedicine Nodal Officer for Kerala, she has been helping us all throughout. Mr. Babu Menon, who is here, all this fanfare, all this, the arrangements his team has done under his leadership. We thank you, Dr. He's a very good friend of ours, and for leading this marketing front and making this a beautiful occasion. We thank Dr. Jaggu and my good friend Bijoy, who is the secretary and organizing secretary of TELEMEDICON. He has become thin. If you notice him, it is because of his the stress he has taken and the persistent efforts in making things happen. So thank you, Bijoy. And last but not the least, the sponsors who have been sponsoring the event, and all the mentors who are in this crowd here, who have taken telemedicine from its inception and to the day-to-day. Dr. Selva Kumar is there, Dr. Mohanty, and so many other members who are there with us. We heard Dr. Kim in the morning. So thank you so much for being with us today and for coming all the way from United States and being with us in this August gathering. Thank you so much.
sir. This marks the end of the inaugural session, and I thank everyone on and off the dais for being part of the inaugural session. Now we may head for lunch, and I wish good luck to all the dignitaries, everybody who's come here today for the next 3 days. Thank you so much.